Webinar, COVID-19, School Response and Operationalizing CDC Guidelines. We know this is a challenging time, and we appreciate you joining us for this webinar today. My name is Sarah Porter, and I'm the Vice President of External Affairs at Healthy Schools Campaign. Today, I'm representing the Healthy Green Schools and Colleges program, a partnership between Healthy Schools Campaign and Green Seal. Formerly called Green Clean Schools, this program leverages more than a decade of Healthy Schools Campaign's work, along with Green Seal's additional expertise, providing even more resources for creating healthy, sustainable, and effective cleaning programs. Before we begin, I'm going to quickly review some basics for today's webinar. Today's webinar will run for approximately 1 hour, and a recording of the webinar will be available to view later. We will email a link to the recording, and it will also be archived on the Healthy Green Schools and Colleges website by the end of the day. We're going to save the bulk of our time today for a question and answer session with our committee members. You can ask questions by typing a question into the questions box located on your control panel and clicking on the send button. Feel free to send questions through the questions box at any time during the presentations, and we will answer them during the Q&A session at the end. COVID-19 has thrust school custodial teams into a frontline battle with infection control and forced leadership to quickly develop and implement processes to address this global pandemic locally. The Healthy Green Schools and Colleges committee members graciously offered to share their experiences dealing with COVID-19 in their schools. In 2 previous webinars, we spoke directly to the concerns of higher education and K-12 districts. This webinar will feature themes that emerged from those 2 webinars. Both of those webinars are available to watch on the Healthy Green Schools and Colleges website. The information shared during this webinar is for general informational purposes only. The experiences and information shared today are not intended to replace, directly supplement, or formally operationalize the guidance provided by the U.S. federal government, including recommendations published by the Centers for Disease Control, the Occupational Safety and Health Administration, and the U.S. Environmental Protection Agency. We encourage you to visit those federal agency web pages if you're seeking formal instruction on how to develop or update your cleaning protocols in response to COVID-19 or any public health emergency. We will include links to these resources in our follow-up email. Today's webinar is a knowledge-sharing event in which the leaders of green cleaning and building operations in higher education and K-12 districts will share their experiences. On the webinar today, we have Mervyn Brewer, Assistant Custodial Supervisor from Salt Lake City School District in Salt Lake City, Utah. Jodi Krause, Assistant Director of Housekeeping at the University of Wisconsin-Madison in Madison, Wisconsin. Christopher K. Rains, Director of Administrative Services at Cosumnes River Community College in Sacramento, California. And Jean Woodard, Director of the Building Services Department at the University of Washington in Seattle, Washington. First, I'd like to introduce Murf Brewer from Salt Lake City School District in Salt Lake City, Utah. Murf?
Well, thank you. I just want to give you a quick background. You've heard about who I am and what I do, but we have about 26,000 students in the Salt Lake City School District. We service, I want to say it's 42 different facilities, including some charter schools and business admin buildings, that kind of thing. Our current situation is that all of our schools are currently in what's called a recess. We are being, the kids have been released until the 1st of May. However, teachers are going to be allowed to come into the building, teachers and administrator, once a week to get any materials they need for the online teaching. We are still serving sack lunches in the parking lots daily, Monday through Friday, to all anybody 0 through 18, whether they're in the district or not, kind of thing. We have had no confirmed cases of COVID-19 amongst our students. However, since we went into a dismissal 2 weeks ago, it was almost 2 weeks ago we went into this dismissal, I don't know that any information has been shared with the school district since that time. So that's something to keep in mind. So our campuses have been officially closed to the general public. We were cleaning and disinfecting the play equipment outside, but they have now officially closed our campuses simply for the fact that they don't want a bunch of kids out there playing around and spreading it to each other. So real quick, I wanted to talk about on-site generation. And the important thing to keep in mind with on-site generation, these generated waters that you hear about, whether it's aqueous ozone or whether it's hypochlorous acid, the devices are EPA registered devices. And they produce a sanitizer or a cleaner that the EPA really at this point, because of what it is, doesn't exactly know how to classify it because they're so used to classifying, I'll just say pesticides. So they're having issues with trying to get all of that classified as proper, quote, cleaner, killers, disinfectants, that sorts of thing. But the different testing that's been done shows that these are very effective in reducing reducing numbers of pathogens, germs, whatever you want to call it. Keep in mind, though, that what people are focusing on so much is the, quote, pesticide, the registered chemical, the disinfectant. What we have learned through our integrated pest management program is that it's not all about the chemical you use. People want to just spray and forget and just, okay, it's done. It's mostly about process. So in spraying something and wiping, that the CDC guidelines for dealing with the COVID-19, for cleaning, say, spray and wipe. You need to clean the surface, remove the soils that can regrow organisms. So cleaning and wiping, that the process is hugely important. And we use a lot of these on-site. We use both aqueous ozone and we use on-site generation of hypochlorous in our process of cleaning and sanitizing. We also use the tablet form that so many people are familiar with. The tablet form, we use that simply because it's easier to transport and have available in all areas at any time. And as we have stated before, that on-site generation, while it is our kind of our number one thing that we use in our daily protocol, normal protocol and this heightened time of infection control protocol, it's our number one go-to. We do use green chemicals as a backup, and that is hydrogen peroxide-based chemicals. Some of them actually do have virucidal claims. So we still maintain a green program. We have protocols in place in using these on-site generated products as both the removal process and as a come back and spray it all down and just let it sit and do its thing type of process. So we use a multi-step process. Anything else? Okay.
No, that's wonderful. Thank you so much for sharing that. I'm sure we'll get more questions when we get to that part of the webinar. Thanks so much. Next, I'd like to introduce Jodi Krause from the University of Wisconsin-Madison. Jodi?
Hello, everyone. I've worked at the university here in Madison for more than 20 years, just over 20. And then in the last 12 years, I have been in the position of Assistant Director for Housekeeping. UW-Madison campus services 45,000 students. In housing, we have 27 buildings, over 3 million square feet, and we house 7,800 residents in those halls. We also have 1,050 apartments, single room apartments, 2-bedroom as well as 3-bedroom apartments. So in apartments, typically annual average, we house another 3,000 students or families in that area as well. We have 85 full-time custodians on day shift and 20 full-time custodians that do our after hours, so from 3 p.m. to 7 a.m. Currently, in the state of Wisconsin, there are 638 positive cases of COVID at last count. We've had 8 deaths in the state of Wisconsin, including our first one in Dane County yesterday. And we've had over 10,000 negative tests for COVID-19. In Dane County, where the University of Madison campus is located, we have 72 positive cases in the county. We have not had a single student thus far be suspected or confirmed to have COVID. We have had one staff member on this campus that has been confirmed with having COVID and is in isolation. With our protocols changing, several of our protocols have changed. The biggest one really for the housekeeping staff is that we, using on-site generated product here for the last 8 years, we had eliminated the use of disinfectants. When I tested our disinfectants against our on-site generated product, the on-site generated product actually worked better. And so we had eliminated disinfectants about 8 years ago, just after H1N1 went through this campus. And so one of the biggest changes is that we've brought that back, strictly following our CDC guidelines, as well as the EPA list of approved products to use. Although we don't have any suspected or confirmed cases in the halls, we decided that we would increase our level of proactivity and continue to clean as we do daily, but we would add disinfecting specific touch points, especially in bathrooms and common areas. Our school is currently closed. Our campus is basically closed. Classes are online. Our students have spent the last week moving out of the dorms, if at all possible. We have several students that were not able to come back to move out. As a result of students unable to travel or go home, we are still housing between 600 and 700 students in our halls until further notice. This week, we are currently condensing them from the 27 buildings down to 3 buildings. We have been asked by the state to turn some of our residence halls over to them. And so we're in the process of consolidating our students. So we are increasing, again, just our disinfecting in those areas. That is also a change in protocol for us to move the students into condensed spaces or more consolidating spaces. We typically do not move students to consolidate, especially during a pandemic situation. We did not do that during H1N1, but because the state has asked to take over our buildings, we are condensing our students. We are spacing them out appropriately, though, throughout the 3 buildings that we are using. So a lot of protocols have gone into, a lot of processes and protocol rewriting has gone into this the last couple of weeks. Our dining halls here on campus are still currently open with extremely limited hours. They have grab and go, so there's no dine-in service, but we do also have to be able to feed our kids. So that protocol has also changed quite a bit. For staff protocols, we are considered an essential service. I know some of my campus partners have unfortunately had to send their custodial staffs home. In the academic buildings, for example, since classes are not in session physically on campus, our staff are still here based on the essential service need. But the protocol of sending people home and assigning them work has also gone through great transition here on campus. Other protocols, our entire emergency protocol has been changed. We were very lucky to have all of our H1N1 information on hand and available to refer back to be able to put some things in place right away. We've developed protocols for quarantine and isolation spaces, which we have set up. We have had to use isolation spaces while some of the residents or students on campus were being tested. Fortunately, none of them tested positive, so we have not yet had to move anyone into our quarantine spaces. But we have our cleaning and protocol and maintenance protocols for those spaces, as well as linen and laundering protocols. We're doing linen for students that do end up in isolation or quarantine, and we are feeding them, providing them in-house food service as well that we deliver on a daily basis. So those are really all of the major protocols that have changed for us. And as I said, the biggest one for the housekeeping staff is the reintroduction of disinfectants into our program.
Thank you, Jodi. It's really interesting to hear all of those changes and how you and your team are managing them. A lot of logistics, and I'm sure we'll have more questions about all that when we get to our Q&A session as well. Thank you so much for sharing. Next, I'd like to introduce Chris Rains from Cosumnes River Community College in Sacramento, California. Chris?
Good morning, everybody. Again, Chris Rains, Cosumnes River Community College in the greater Sacramento area. My role is the Director of Administrative Services, where I oversee print services, custodial, maintenance crew, operational staff, million square feet worth of facilities, 14,000 students. We serve over 1,000 employees work on the campus. I also oversee external facility use rental and internal facility use for non-educational purposes. It's coordinated through my office. So I pretty much get to be in everybody's business on just about everything. Currently, we don't have any students on campus. We shut the district down on March 11th for teaching and students on campus, and on March 17th was our last operational day for the entire district. We've gone to a full online mode that included everybody along with custodial. Just everyone got sent home and stayed home, and they have a very stringent process to get back onto campus if you forgot something. It goes all the way up through the Associate Chancellor of Finance to get permission to go back onto campuses. So it's been a real interesting transition into that in that very short period of time. When I got to thinking about it, we've only been away for a week, and it seems far, far, far longer than that. We recently, though, as of last night, one of our external facility users that we rent our facility to a professional soccer club, and one of their players has a confirmed case of COVID-19. The silver lining on that one for us is everyone was away and gone before this triggered, so we think we dodged something there on that one. Thoughts and prayers to the player that has been exposed with a confirmed case. So that is what we're dealing with there. And on the shutting down of the buildings and the process that we went through, the district made the call at the start that we would go through the buildings at a restart process instead of cleaning everything and shutting everything down and then sending everybody away. We just made sure, anything that could smell bad from a refrigerator, all that got disposed out. And then that last work day, we just locked our buildings up, secured and tight, and sent everybody home as quick as we could just to keep everybody in that isolated thing. Because I think it was 2 or 3 days later is when California did the really high recommended of shelter in place and only go out for essential needs. I'm along with Murf and Jodi on the on-site generation. We've been testing those items, and we're still in favor of using those instead of the traditional chemicals we use them. But again, I prefer to try to keep it as healthy and as sustainable as possible in the chemicals that we use to clean our buildings on a daily, weekly, and monthly basis. that is all I have, unless you need more.
Thanks, Chris. That's really helpful to hear. It's interesting what you shared about your sort of plan for shutting down and then leaving more to decide on reopening. And while it's unclear at this point exactly when schools will be reopening, it's definitely something that we will plan to feature in future webinars, and as we kind of gather strategies from folks about how they're thinking about reopening their facilities at that time. So definitely something to foreshadow for future content, and we'll ask you to participate with us again at that point in time. So glad that you hit on that. I lastly would like to now introduce Jean Woodard from the University of Washington in Seattle. Jean?
Thank you. Good morning, everyone. I'm the Director of Building Services at the University of Washington Seattle campus. We have 3 campuses, one in Tacoma, one in Bothell, about over 47,000 students. On any given day, under normal circumstances, the University of Seattle campus will have about 70,000 people on campus. For the last few weeks, we've had maybe a couple of thousand people. We're now in modified operations. And I'll go back just a bit. We did go to online courses on March 6th, which essentially shut down the spring quarter in-person classes 2 weeks ahead of the spring break. And our first goal that we set out to achieve during that 3-week time, when there were fewer students on campus and as more faculty and staff started working remotely, we had a 3-week plan to disinfect all common areas, the libraries, the classrooms, to really do a deep cleaning. And that plan quickly changed. Seattle, as you know, is the kind of the epicenter. I think New York has now passed us with more cases. The state of Washington has confirmed positive COVID-19 cases of 2,469 as of yesterday. That number's probably gone up. There's been 132 deaths in the state of Washington. King County, where the University of Washington Seattle is, has 1,359 confirmed cases and 100 deaths. The University of Washington has had 29 confirmed positives. I lost track of initially it was more students, but over the last week we've trended with faculty and staff, and unfortunately we've lost 1 faculty member to COVID-19. During the first phase, we checked with our EH&S. We really linked arms with them to assure that the cleaning protocols we were using to deep clean these spaces were meeting the CDC recommendations and our King County Health recommendations. We wanted to make sure we had all of our appropriate PPEs in place, which were gloves and gowns. It took us a couple of weeks before we were able to get gowns. There's been controversy over the N95 mask, and that was something that I've been working through with my team. They would like the mask, but the CDC does not recommend them. The quaternary ammonia disinfectant that we use does not require them. And we understand that our med centers, it's in short demand, and people that are on the front line and the highest risk need to have any inventory that's available. So our first goal, as I mentioned, was to deep clean and to frequently disinfect high human touch points. The president pretty much for spring quarter, it's going to be all online. And so we shifted our goal and our priority to also do projects, floor work, deep clean spaces, clean carpets, do the kind of cleaning we have not been able to do ever because of all the activity that takes place. That goal shifted when Governor Inslee went to a stay home, stay healthy, and we went to modified operations. So our goal at that point was our three goals were to help protect the community by, allowing as many people to stay home and to slow the curve, which is growing exponentially. Our second goal, and has always been one of our goals, is to keep our staff healthy and safe. And then the third goal was productivity of our staff. So we're starting tomorrow, we're going to have 1/3 of our normal staff on campus. We're going to be rotating people on a 2-day or 1-day schedule and 2-day, 1-day off. So we went from approximately 300 staff on any given day to about 120 on staff. The university never closes. There's research. It's being limited to mostly research on the COVID-19 vaccines and prophylactics, and there's quite a bit of leading edge research that's taking place here that we need to support. There's still some students on campus, and faculty will be coming back to do online teaching in some of the classrooms on campus. So what I think everyone should think about, regardless of what phase they're in, whether it's initial outbreaks and concerns and deep cleaning and protecting the population that's attending your facility, or whether you're on some modified schedule or even shut down completely, you want to check your supply chain to make sure that necessary supplies and equipment are available. There's some products that are on back order or very hard to get. Hand sanitizer, the mask, any protective PPE. Gloves so far are still available, and toilet paper, paper towels. We increased our on-hand inventory from 1 month supply to a 3-month supply, just to have a cushion, and without thinking we'd be hoarding too much. Refresh your training, especially as it comes to disinfectant, so the custodians understand the concept that they're cleaning what they can't see, and also implement measures to give people a break from using the disinfecting. We only used it in restrooms prior to this, or our high touch points. Now our custodians were disinfecting almost their entire work shift, and that can create some concerns on their part. Our protocols have shifted now. If there is a confirmed case, we make sure that our EH&S has conducted the interview with the person who tested positive to find out exactly where they spent a time, when was the last time they were on campus, when did they develop symptoms, and if it was fairly recent, we'd want to make sure it was at least 24 hours time had passed prior to sending a team in. And we have a maintenance custodian crew that has additional training, and they've been responding wonderfully to the various requests to clean rooms, offices, classrooms where the positive cases were at. We make sure we wait 24 hours. The virus is carried in the upper respiratory system, so there's a strong chance of, if you're within 3 feet of someone who's infected, the droplets can come out and you can ingest those either through your eyes, nose, or mouth. But after 3 to 4 hours, the droplets are fairly heavy and they drop to any horizontal surfaces. And so we try to ventilate the spaces, open up doors to get air circulation, and we'll send our team in. Usually it's been well after 24 hours, and they'll disinfect every surface in the room. We have signs that we put on the doors after they've been deep cleaned to notify staff and the public, and we communicate that back. It's also important to communicate to your stakeholders. We have building coordinators for our 175 buildings that we service, and we had a Zoom forum with them to really fully explain what we were going to do for the 3-week period. And during that time, we also moved to locking and securing all the buildings. So all our buildings on campus are now secure. So moving forward, we need to continue our communications with the union. The union had some concerns about possible overexposure to the disinfectant by their members. So I've had 3 or 4 meetings with the union and HR. It's good to just be as transparent as possible. I've attended meetings with all of my staff all along the way with an occupational health physician to really talk about the risk, to reinforce proper hand washing, social distancing, and just ways to protect yourself and using universal precautions when you're cleaning, just assuming that everything is contaminated. The social distancing has been a challenge when we'll probably solve that starting tomorrow when we will only have a third of our team members here. But clocking in and clocking out, we had to put tape in the spaces to keep people 6 feet apart. We have people that van pool, which we've encouraged over the last few years. We had, with the governor's order to stay home, stay healthy, we implemented or discontinued the van pools. So there's a lot more I can talk about, but I think I'm out of time.
Thank you, Gene. You have so much to share. We really appreciate. As you mentioned, you're sort of at the epicenter of this across the U.S., and it's really helpful to kind of hear where you've been and where other folks can be expecting to be next in the coming days and weeks. So really appreciate you sharing that your experiences with us. And thank you all of our panelists for sharing with us today. Now we're going to move to our Q&A session. And to help us with that, we have Mark Bishop, another committee member, who will be directing questions during this session. Mark?
Yeah, thank you so much. Let's just get started. Questions have been coming in. If you do have questions, keep asking. We're going to get to as many of them as possible. Let's just get started. I am going to start by asking Murf a question. Question for you, Murf. Are you disinfecting the entire building after staff come into the building every week? So, because you mentioned that staff still had access to the building, what kind of additional requirements is that placing on your cleaning crews and your procedures for disinfecting your buildings?
Okay, to start with, we did have, of course, teachers and other folks access in the past week or so. It was actually last Thursday that the superintendent did a complete let's lock the buildings up type of thing. But from that Thursday until now, my custodians have been cleaning all vertical surfaces, all horizontal surfaces, all walls, and all of the corridors, classrooms. Everything has been a deep clean, and then go back afterwards with the electrostatic sprayer. What our plan is, as we get teachers in the building in the coming weeks, is they will only be allowed in on one certain day. And once they leave, our custodians will, of course, identify those areas where they have been, and those are the areas they will go back and do either a cleaning and sanitizing or just a sanitizing, depending on what is needed and where they have been and things such as that.
And Murv, let me just follow up on that. You said sanitizing versus disinfecting based on what is needed. Who determines what is needed? What are the criteria for that?
Let's say a teacher walks in through the front doors, walks down the hall, goes to her classroom, opens up the door, goes in, grabs some material, is there for 5 minutes maybe, and then leaves. Our custodians the touch points will be scrubbed and cleaned, okay? The other areas, such as just the general room itself, will be sprayed with the electrostatic sprayer. The hallway itself that the teacher is in will be sprayed with the electrostatic sprayer. But anything that they have, quote, touched, or any place they could have touched on the way in or out, will be cleaned first and then disinfected.
Okay, great, thank you. I'm going to continue on. Jodi, I have a question for you. You mentioned that you eliminated your chemical disinfectant outside of your on-site generation after H1N1 because you found it to be more effective when you did testing. So could you speak briefly to the testing? And then as a follow-up, sorry, Jodi, you work with my train of thought here. Can you now say you're reverting back to old H1N1 protocols. Did you have to update them? Did you have to retrain staff on them? What were your biggest challenges bringing in old protocols in a short period of time?
Okay, so first let me respond or address the testing. So following H1N1, we moved to using aqueous ozone, stabilized aqueous ozone here on campus or here in housing rather. Before we made that switch, it was my responsibility to test bathrooms and common spaces, our cleaning of those spaces with the stabilized aqueous ozone and compare it to disinfectants and other things like general cleaners and window cleaners that we had in place in our program at that time. I did all of that testing for more than a year throughout our buildings, following multiple staff, using an ATP meter to do our testing. Just briefly, the handheld ATP meters help us get a numeric measure of soil left on the surface before and after cleaning and disinfecting. After that testing and a lot of conversations, we actually fully switched to aqueous ozone, which is a sanitizer for our buildings. And that is currently what we use and what we have been using for the last 8 years. So we eliminated disinfectants, general purpose cleaners, and window or glass cleaners from our program. In terms of reintroducing the disinfectant for our COVID-19 situation, we wanted to follow, obviously, in an educational setting, we want to follow the EPA recommendations about what could be used for this particular virus. In terms of putting that back into place, we did retrain staff on how to use that. Most of our staff, we're very fortunate, knew how to use disinfectants in terms of the dwell time versus what we have our dwell time for stabilized aqueous ozone. It is quite different. So there was some retraining involved. It was actually completed within a day. We made the decision rather quickly to reintroduce disinfectants in terms of disinfecting high touch points to take some proactive measures. So it's 10 to 15 touch points throughout the building that we disinfect every day: door handles, light switches, sink faucets, hand soap dispensers, those types of high touch points. So it was fairly quick for us to retrain staff.
Okay, great, thank you.
Yep.
Let's see, next question. Let's keep going. Chris, here's a question about air handlers. Have you put any thought into changing filters or any type of univents, filters, to make sure that the air you're circulating is clean? Has that been a consideration?
That part is handled by the district's facility maintenance department. But one of the steps that we did on the shutdown was the majority, and I'm wanting to say almost 90% of the campus HVAC systems were either greatly reduced or shut off. Why the building is not in use? Just to save the energy. There's no reason to cool it or heat it if there's no one in it. And I'm sure that'll be one of the things that'll be looked at as, again, we go back to the coming weeks when we get the green light to start the physical plant back up, the steps we'll take to make sure we can articulate out to the college community of the steps that we've taken in preparation of them coming back, in everything from an HVAC filter to how the classrooms and doors and common touch points have been cleaned prior to everyone coming back on campus.
Okay, great. Thank you, Chris. Gene, here's a question for you. It sounded like you have a lot of coordination between your custodial department along with the, I'm not sure if it was health or HR departments, around identifying infected staff, student. So who led the effort to make sure that this was coordinated? Do you have a joint agreement between departments? How is this common, and was this something new to your organization? And if so, how did you get started?
Yes, this was something very new to us. Our environmental health and safety department has taken the lead, and they've worked closely with the local health officials, and we also plugged in our physicians at our medical center. And immediately, almost the Sunday afternoon when we had the first case, we were on the phone with each other, phone conference call, coordinating the protocols, establishing how the work orders would go. Those protocols have shifted over time as time has gone on, but it's one of the first things that we did. There's also a daily meeting with facility administrators to check in, and we talk about our priorities and tweak any protocols that need to be tweaked as we learn. Usually a student or a faculty member develops symptoms. They're tested. EH&S is then notified. Then we will not take any instructions from the building coordinators about deep cleaning unless it goes through EH&S and it's been vetted. Here lately, building coordinators know about a positive case and they'll request us to clean, but we make sure it's all vetted through our health and safety professionals.
Great, thank you. Questions are pouring in. We will keep asking, so we're going to try to get to as many as we can. Let me go to Murf. This may be a quick one. So I'm going to kind of piggyback two questions. First one is, you said you have a protocol for the products that you are using around your disinfection. And this, I'm going to ask this as a question and then pose this as a statement for everyone. Are you able and willing to share your protocol with the participants of the webinar? And then this related question is the disinfectant products via on-site generation. Is that on EPA's list N? That's of course the list of allowable products for disinfection of the coronavirus. Murf.
Cool, got it. So yes, of course, we are a public entity, so it is public domain. We actually have our protocols on our on our department YouTube channel, which is Salt Lake City School District Custodial Services on YouTube. We have our protocols there for our custodians, and it is a public domain. So that's number one. Number two, as I had stated earlier with on-site generation as in those machines that create a split stream or aqueous ozone, those are EPA registered devices. However, the chemical is not on the EPA's list, okay? The emerging pathogens list, it's not on either one of those lists. However, we do use, and I would call it on-site generation, it's using those little tablets that you drop into water. They create the hypochlorous, and those are actually on the emerging pathogens list and the EPA's list as well.
Okay, great. Thank you. Let me see. Let me keep going. Jodi, there were a handful of questions about your ATP testing. So can you talk, do you still do it? If so, what's your frequency? What's your record keeping? And would you be able to share any types of data that you have collected?
So for our ATP testing, we do still perform ATP testing. It has changed since we originally did it. Our original data unfortunately was lost when our Tech Services Department lost the ability to have the software. So the records from our initial testing, I basically only have in clips that I've shared out multiple times with different folks to show them what the test results look like. But it's a software program that comes with the handheld meters that you download. So we do currently use our ATP meters. We updated the type that we use, and our custodial staff, we test the touch points in each individual's assigned area 4 times a year to ensure that we are still meeting the standards that we use, and we follow APA standards. So cleaning level 1 in bathrooms and cleaning level 2, APA level 2 in common spaces. So we do test behind our custodial staff 4 times a year. Each person, every touch point, if that makes sense. Okay.
All right, thank you.
Sorry.
And did you say, is this information you're able to share or not?
Yeah, so I am absolutely able and willing to share anything that I have in terms of how the testing works, how it's performed, how we picked our sites, any of the data that we currently have, or any of the previous data that we had that allowed us to switch from traditional chemicals to stabilized aqueous ozone. So any of that information that I have, I'm willing to share. Folks just want to reach out to me.
All right, great, thank you. All right, Chris, question for you. Do you have a list of the top touch points that you are cleaning, sanitizing, disinfecting on an ongoing basis as a checklist for your custodial staff?
We do have a checklist, and I usually start it with the eyes, the knees process of if it sort of lands in that, if it's vertical or horizontal, and it's from your eye to your knee. Keeping in mind, we do point out those that are I'd like to say Wookiee tall or vertically challenged. We do make some adjustments for that type of training just to keep it relevant and in the ballpark. But we do have just the standard list of walk through, hit these points, go through that to just so we can go back through and check up on them, because we also do use an ATP meter too to just verify that certain things are getting done. It helps in a training sense to especially during processes like this, to reinforce with the custodial staff that what you're doing is working. Please continue it this way, or if we do have to do a little bit more coaching on what they need to do a little bit better on. It's removing something you can't see is always tough for some people to sort of get if they're doing it right or wrong. It's one thing when you're taking a lot of heavy grime off and you can see the progress you're making. When you're removing things you can't see, you could be doing it incorrectly without some backup verification, just to positively reinforce the efforts we're going through. On the backside of that, then, to be able to share that with the college community on, see, this is what we've done, this is how we're doing it, these are the results. You have a clean, healthy facility to come back to.
Great, thank you. Gene, you mentioned the controversy around N95s for the custodial staff. Well, the question is here, how has that been received? There has been some stories of staff threatening to sue school districts for not supplying N95s. Have you seen that? Have you had any pushback from your staff? How are they relating to this lack of PPEs?
It's a very, very good question. Before I answer it, I'll just mention what Chris described with the ATPs is exactly what we're doing here, and I can share some of our recent data. We have all of our protocols on our website, University of Washington website, EH&S, and then you look at coronavirus cleaning. There's a lot of information there. And we also have, we created a revised list of touch points that we can also provide. There's been some pushback from certain custodians, primarily the ones that are active with the union. And we've had the 3 meetings, as I mentioned, and I've also brought in the health professionals there. There's no recommendation from CDC that the N95s need to be used if you go into a room after it's been vacated for, up to 24 hours. It doesn't really help, or we don't have the type of cartridge that helps with the disinfectant, the organic filters. And so we also have a Lni complaint that we're responding to today. Primarily the complaint was that we didn't train our staff appropriately. So we're providing at least 300 documents to verify our training, that it's and our ongoing training on use of the disinfectant and all of our cleaning solutions. So this is an ongoing issue. We just try to assure our staff that we wouldn't expose them to any risk. And so it's been minimal, and I think we've been able to address the majority of their concerns, but there's a few people that are a little more resistant to it. So it's an ongoing process.
Thanks, Gene. Then let me follow up with another one. You're using a quat-based disinfectant? Do you have any issues with mitigating any potential risks of exposures to quats, or have you discussed that?
Yes, that's been part of our training. I didn't quite catch all of your question, Mark. Could you repeat it?
Related to exposures to quat-based disinfectants during this outbreak.
Yes, we've asked our team members to take frequent breaks if they feel that they need, they're having any kind of symptoms or reactions to the quat. We've not had any complaints other than about the smell. After a while. We had heard that there were some people that had concerns about skin irritation and eye irritation, but we couldn't, that was kind of a vague complaint voiced by the union. And we went back and talked to every one of our custodians, and we couldn't pinpoint who might have had those issues. So the issues have been with the smell, and now we're no longer in the deep disinfecting mode, where we've shifted that to more regular cleaning now and only responding to positive cases. And we've also are looking for a hydrogen peroxide product, but we've been unable to find any available that meets the EPA standards. So we're hoping to get some hydrogen peroxide in the near future, so that we can see if that is less of an issue for our staff. So that's how we've been dealing with that.
Great, thank you. We're starting, you know what, it's 12:55 over here, so I think we're gonna have to wrap up. So I have my one last question for all of you, and we'll just go in order. The question is, all right, you guys have been on the front lines for the past month or so, working your tails off. What do you see as the one lesson that you have learned in these challenging times that will change how you do things in your program moving forward? So Murf, I'm going to ask you to start first. So what's the one lesson you've learned that will change how you do things moving forward?
I think the thing that we learned is that being proactive is definitely the best response. You know, being ahead of it and being stocked and well supplied. What we would change in the future is endeavor to be even more so, even though we are in great shape right now. Be even more so ready for different contingencies, different things that may come up.
Mm-hmm. That's great. Jodi, what is your one lesson?
I would say what we are currently learning every day is that we can never be too prepared. We're lucky. We've had our communications plans. We've really just had to kind of update them for this particular pandemic. But for folks that thought, you know, we had too much detail and we were too prepared and we did too much planning, like, you can't be too prepared. There's no such thing. And I think how that'll help us change, or what that'll change, is that we also have learned that sometimes previous models really do work best or work consistently. So don't be afraid to look at what you've done in the past to be able to handle what's in front of you right now.
Great, thank you. Chris, your one lesson learned.
More transparent in the processes that we already have in place to lessen some of the anxiety of how the facility is being maintained. You know, a little YouTube clip that I've seen with that Gene had on what they were doing and how those things, like those little tricks on putting it out there so you can quickly convey, this is what we're doing, this is how we're using it, these are our steps, and you, again, 2.5 minutes, boom, it's there. Just to have that type of stuff in place going forward, I think will help if this ever happens again, which I hope it doesn't, but to have stuff like that in place and already have that practice out there of sharing how we're cleaning the facility for the students and staff.
Great, thank you, Chris. Gene, you get to wrap up. What is your one lesson learned?
I'm gonna look for a hydrogen peroxide product.
Okay.
To replace the quat.
Mm-hmm.
So that's one lesson. And just to piggyback on what's been said already, I have an objective of being a hands-on leader, being present and engaging with my staff, and I think that has really helped us this past month. And so that reinforced to me that I need to keep flattening the organization and being out there and giving people an opportunity to express their concerns, to give ideas and provide solutions.
Okay, great. Thank you all. I want to thank all the participants for asking great questions and being such an engaged audience. I'm turning it back to Sarah. Sarah, it is your responsibility to get all protocols and documentation from the panelists and share it out to the participants today. So I'm sure they will be very appreciative. So thank you all very much. Sarah, the floor is yours.
Thank you, Mark. I do want to take a moment now to thank the sponsors of the Healthy Green Schools and Colleges program, including Platinum sponsor Diversey, for their continued support. And also thank you again, Murf, Jodi, Chris, and Gene, for making time for this important discussion, and Mark for helping field questions. Thank you all for attending. Please contact Dion Glasser, the Program Director of Healthy Green Schools and Colleges, with any questions. She was not able to join us today, but her contact information is listed here. And as you mentioned, Mark, we will be collecting all of the resources and data and materials that the committee members mentioned that they would be willing to share. We will send out an email with those, along with the links to some of the other CDC and EPA guidelines that we referenced earlier in the webinar. It may take us a day or two to compile everything, and it may come out in 1 or 2 emails, but we will make sure that that information is available to everyone. And the recorded webinar will also be available on our website as well. So thank you, everyone, for your time and attention and for your participation today. Thank you so much, and stay well.